Community Health Worker Training, Cardiovascular Health and Diabetes, Mini Module 9B, Getting the Most Out of Doctor's Visits. Learning outcomes for this mini module. Name 3 things a patient should do to prepare for a visit to their doctor. Name 3 questions a patient should ask during a visit to their doctor. And explain why using a trained interpreter rather than a family member is important. In past years, most people considered their doctor to be the boss for issues concerning their health. You were expected to do what the doctor said, no questions asked. But the role of the patient in healthcare has changed. Now you are your doctor's partner in healthcare. Today, a good patient-doctor relationship is more of a partnership. You and your doctor can work as a team along with nurse practitioners, nurses, physician's assistants, pharmacists, community health workers, and others to help you with your medical problems and keep you healthy. One way to get high-quality healthcare is to find and use information and take an active role in all of the decisions made about your care. It's not always easy to take an active role in your care. Most doctors plan only 10 to 15 minutes for each visit. With such a short amount of time, you may not feel comfortable taking the time to ask questions, or you may feel rushed, or you may have trouble remembering what you wanted to ask. So let's talk about how to prepare for a doctor's visit so you can get the most out of it. So first of all, preparing for your visit, before you even come, you want to call the doctor's office and make sure the doctor has your medical records, particularly if you're transferring to a new doctor or if you have seen another doctor in the meantime. If you've gone to a specialist or if you've gone and had lab work or had x-rays, you want to make sure that all of that has gotten to your doctor and to your chart so that you can talk about it when you're there. Bring a list of all your medications. When you arrive, the nurse is going to ask you for a list, and so if you can just hand her a list, that is very helpful. Ideally, the list will include the dosages and how often you're taking them. If that's too much trouble to make a list, put all of the medications that you're currently taking in a bag and bring it with you to your appointment. Bring it in the original medicine bottle or packages with the labels still on them. Be sure to include all over-the-counter medicines, vitamins, and herbal products or other supplements that the doctor did not prescribe for you, including cold and sinus medicine and pain pills, and maybe cultural medicine. Certain cultures, people take herbal-based medicines, and it's really important that your doctor knows about everything that you're taking. Bring your health insurance card. They're not going to do much for you without that. Of course, certain clinics will see you without health insurance, and that's important to know. Where can you be seen without health insurance? By the way, you also need to bring some form of a photo ID with your health insurance card so that they know it's really you. Bring a notebook of all your symptoms, questions, and concerns. Write down any questions you want to ask the doctor, and also make a list of what you want to talk about, because when you're in the middle of a visit and you're feeling rushed, it can be easy to forget important things. Bring someone with you. Again, this person can help you remember the things that you want to bring up, and sometimes it can be less intimidating if you've got a support person along with you. If you wear glasses or use hearing aids, don't forget to bring them with you. It's very important that you be able to communicate clearly and hear what the doctor and the healthcare team is saying to you. And in terms of glasses, it's important that you be able to see and to read anything that the healthcare team may want to share with you. Being a prepared patient. This short video explains how to best describe your health problems to your healthcare provider to give them the information they need to diagnose the problem and treat you effectively. Patients do not need to memorize these steps because the healthcare provider should ask follow-up questions to get all the information they need. However, if you are accompanying a client to a healthcare visit as a community health worker, and you know they're not sharing some important details of their condition with the doctor, you should prompt them to do so. So go ahead and click on the link to watch this video and then return to the PowerPoint.
Over the years, we've listened to hundreds of people discuss their experiences with their health and health care. One thing that seems to come up for many people is how hard it can be to find good health care and make the most of it, which includes knowing what to do at a doctor's appointment. Whether it's your first visit or your 10th, there are things you can do to maximize your time with your clinician. Office exams for most routine problems are usually very short. You may have just a few minutes to describe your concerns. So when the doctor or nurse practitioner asks, "What brings you here today?" they're looking for very specific information. Giving a clear description of your problem will help your doctor figure out what's wrong and how to address it. Even if you're feeling embarrassed about the problem or your symptoms, you can trust that your doctor has likely seen it before. Here are 4 things you should be prepared to tell your doctor or nurse practitioner during your appointment. First, why you were there. Start with 1 or 2 sentences that sum up what's bothering you. This short description should include when or how your problem started or when you first noticed it. Be as specific as possible. Just saying it hurts is not enough. Use descriptive words like sharp, dull, tight, itchy, or aching to describe how you feel. It may help to rate your pain or discomfort on a scale of 1 to 10. For example, "I'm here today because I fell last week and I have a constant throbbing pain in my knee. On a scale of 1 to 10, my pain is a 7. Second, describe how your problem affects your daily life, including your ability to sleep, to work, or to eat. Describe any changes in your energy level or your ability to get around. For example, "I can't walk up or down the stairs anymore." Third, explain everything you have tried to make your problem go away. You might say, "I put an ice pack on my knee in the evenings and take aspirin 3 times a day." If you haven't tried or taken anything, tell your doctor that as well. And finally, you should tell your doctor if you've noticed any patterns or changes. For example, "My knee hurts worse in the mornings and is now red and warm to the touch." Being prepared with these details before your appointment will help you communicate clearly with your doctor and get you started on the road to recovery.
Now, what about during the doctor's visit? The first thing that's important for a patient to do is to take notes, to bring questions, and to write down the answers that they get. If they're coming in with particular concerns, they should bring up the concerns that are most important to them first, in case they run out of time by the end of the visit. Some important questions for them to ask about their condition. Maybe, what is my main health problem? What do I need to do about it? And why is it important for me to do those things? Give complete information. Tell your doctor about aches and pains and other physical feelings you might have, such as tiredness, dizziness, or nausea. You should also tell your doctor about other types of feelings, such as feeling sad for a long time or feeling very anxious or stressed out. When your doctor asks you a question, try to give as much information as needed, but stick to the point. Again, say the things that you think are most important first so you don't forget it. You'll have a much easier time giving all the information if you use a health diary or if you write down your symptoms. Don't be nervous about talking to your doctor or nurse. They want you to let them know when and what kind of help they need. Ask clarifying questions if you don't understand anything the doctor says. You might say, "This is new to me. Will you please explain that to me one more time?" Jot down notes, and often they will give you handouts so that when you get home, you can reread things, because often if there's a lot of information given at one time, or if you've just had a very emotional diagnosis like a cancer diagnosis, it's very hard to retain a lot of what you're told. So don't be afraid to ask questions. And even when you get home, don't be afraid to call the doctor's office back to ask questions. That's actually part of the nurse's job, to help answer any questions that come up for you later after you leave the office. Be honest. It's very important to be honest with your doctor about your health problems. You should also be honest about your lifestyle and habits. Be honest about how much physical activity you get each day, how much you smoke, if you smoke, how much of other types of substances you may use, what and how much you eat. You may want to ask your doctor a question that's a little embarrassing or uncomfortable. Just remember the doctor's probably heard it before. Doctors are used to talking about personal problems with their patients. What you tell your doctor is private and is not shared with anyone else without your permission. Remember that asking questions and being worried about your symptoms is not a sign of weakness. Being honest about what you're feeling does not mean you're complaining. The doctor needs to know how you feel. Ask for written instructions when possible. And you want to make sure that you ask for them in the language that you're most comfortable with. Now that we have the internet, even if your doctor doesn't have handouts in the particular language you speak in their office, they can find them online and print them off for you. If you can't read or understand written information, it's very important that you ask a family member, a friend, or someone else to help you understand this information. Sometimes you can also ask your doctor for a DVD or some kind of online type of information site so that it's not just print information if you're not comfortable with reading. So the three main questions you should ask your doctor. Again, what is my main health problem? What do I need to do about it? So what treatment are they recommending? And why is it important for me to do these things? Do you need an interpreter? That's a really important question. If the doctor you selected or are going to doesn't speak your language, you should have an interpreter. And legally, they're required to provide one for you. However, you need to let them know ahead of time that you will need one and what the language is that you will need them to find an interpreter for. So if you can't speak enough English to explain that to them, see if you can get a family member or a friend to call them with you to make sure that they know that you need an interpreter for a particular language. Sometimes community groups can help find an interpreter, particularly if you speak a language that's not common in your area. Sometimes doctors ask a staff member to help with interpretation. Sometimes patients decide that they want to bring a family member or a friend to interpret for them. This is really not recommended, and there's a few reasons why. The first reason why is that even though the person may speak English and your language perfectly well, they may not know terminology in English. So they may be able to have normal conversations, regular conversations, but that doesn't mean they're going to understand the terminology that the doctor is using, and they may not admit when they don't know what something is. You may find that you feel uncomfortable being totally honest with your doctor if the family member or the friend is interpreting for you. And sometimes people don't interpret properly, so they do the best they can, but if there's any lack of complete ability to interpret fully, the doctor may not get all of the information that they need to really diagnose and treat your condition, and you may not get complete understanding of what they're saying back to you. So all around, it's much safer for you to have the doctor work with a professional interpreter if you need a language interpreter. And again, they are required by law to help you arrange that or to arrange that for you, so that you need to talk with them about that ahead of time so that the interpreter is there for your visit when you go. So what should you do after your doctor's visit? It's important that you understand what your doctor has told you and you're able to follow any advice or instructions he or she gave you. After your visit, call the doctor's office and ask to talk to the nurse if any of these things happen. If you still have questions, or if you're having problems following the doctor's advice, this could be any type of problem, right? So maybe the doctor told you to take a certain medication, and when you go to the pharmacy, you find out that they don't have it or that your insurance doesn't cover it. Don't just not take it. Call back and talk to the nurse about it, and they will make a plan to try to either get you that medicine or to switch you to a medicine that is covered, for instance. You should also call back if your symptoms or condition get worse. If you've had a test done and didn't hear back from the doctor about the results. If you have questions about taking your medicine or you have problems with the medicine yourself. Or really just anything else that you think you need to follow up with them, that either that it's important for them to know or something that you have questions or concerns about that didn't get addressed at your visit. As a partner in managing your health, you need to be ready in case of a medical emergency, such as a heart attack or stroke. This is especially important if you have a disease or condition that could cause a heart attack or stroke. To be ready for a medical emergency, make a list of the following important telephone numbers and put it where you and others can easily find it. Your name and the policy number for your health insurance. The name and phone number of your doctor. The name and number of your power company. This is important in terms of things like if your heat goes out in the winter, or if you have asthma and your air conditioning goes out on very hot days. It's also important if you use electrical equipment such as a machine to help you breathe. The phone number for the fire department, unless it's 911. A list of your medications. The name and numbers of friends or family members that you want notified if something were to happen to you, if you were hospitalized, for instance. And the name and number of a 24-hour pharmacy close to your home. Nobody plans to have a heart attack or stroke, but just as people practice what to do in case of fire, you can prepare for a medical emergency, yours or someone else's. Keep in mind that the time to prepare is before a life-threatening emergency happens. Then if something should come up, you can act quickly and calmly and can do the right things fast. Community health workers play an important role in helping people make the most of their doctor's visits and prepare for medical emergencies. How can community health workers help people make the most of their doctor's visits? You can assist clients to prepare for the visit by helping them to organize their healthcare information, such as medicines they're taking and other doctors they've seen recently. You can help them list topics they want to speak to the doctor about and list questions they have. You can encourage them to bring a family member with them. You may need to help them arrange transportation, language interpretation, and other services that they need for the doctor's appointment. You can advocate for the client with their permission by bringing up concerns they're uncomfortable sharing or by discussing realities of their lives that may make it difficult to follow a particular care plan. And after the visit, you can check their understanding and intentions with regard to the care plan. Check if they need practical or emotional support to follow through on any aspect of the care. Now you can name 3 things a patient should do to prepare for a visit to their doctor. Name 3 questions a patient should ask during a visit with their doctor, and explain why using a trained interpreter rather than a family member is important. The next mini module 9C is about medications.